Hello, and welcome to our Referral Out volunteer training. Throughout this presentation, we'll be discussing what referrals are, why we provide them, how we provide them, as well as give an introduction to some of the agencies that we refer to. Our Emergency Food Hamper program is most likely our most well-known program. Each year, this program distributes around 100,000 emergency food hampers. Clients can access this program in one of three ways. So by phoning our hamper request line, through an approved agency referral, or online via our website. Our emergency food hamper program has also changed significantly throughout the pandemic. Prior to COVID, clients could access a maximum of 7 hampers in a 12-month period. Clients were able to call us and request a hamper themselves for the first 3, but if they needed more, they would then have to contact a community organization who would then submit a referral on their behalf. The purpose of this was to connect clients with external organizations who could provide them with additional resources. We removed this requirement during the pandemic as many agencies were not operating at their fullest capacity, and we wanted to reduce barriers for our clients.
In February 2021, we connected with many of our referral partner organizations and learned that they have the capacity to support clients and to receive referrals from the Calgary Food Bank. This is where you come in. Call centre volunteers will be asking clients if they are interested in exploring community resources. If they are, a time will be scheduled for you to guide the client through a structured questionnaire to identify appropriate community resources for their situations. We'll go into more details about the tools you'll be using during this presentation. We provide referrals because we know food provision will not eliminate food insecurity on its own. Our vision at the Calgary Food Bank is to see a hunger-free community, and we aim to do so through our mission of fighting hunger and its root causes. Food insecurity is a complex social problem that is affected by large interdependent systems that are difficult for a single organisation to change alone. We work towards our mission and our vision through these strategic priorities: feed, lead and connect. Feed refers to how we tackle hunger now. Our main programme, the Emergency Food Hamper programme, is our key way of tackling this issue. Lead refers to making the Calgary Food Bank a strong and knowledgeable voice within the food insecurity sector. Connect refers to how we connect clients with community organisations so that we can meet their needs. It also refers to the way in which the Calgary Food Bank collaborates and works collectively with organisations in the food insecurity space towards the bigger picture of tackling root causes.
So what exactly is food insecurity? Food insecurity is the extent to which households can reliably afford the food they need. Food insecurity can be categorized in 3 ways. So marginal food insecurity is the worry about running out of food and/or limited food selection due to lack of money. Moderate food insecurity is the compromise in quality and/or quantity of food due to lack of money. And severe food insecurity is missing meals, reduced food intake, and at the most extreme, go days without food.
We know that there are many issues and factors that contribute to food insecurity, which is ultimately a consequence of income insecurity and poverty. There is evidence that food insecurity is reduced by policies that improve the adequacy of household income. For example, Newfoundland and Labrador saw the prevalence of household food insecurity drop from 60% to 34% when they made significant changes to their social assistance programs. Canada's Guaranteed Income Supplement for low-income seniors drops the probability of food insecurity by 50% among this group when compared to low-income adults in their 50s. When CERB was introduced, the Calgary Food Bank saw an overall decrease of 6% in usage of the food bank from 2019 to 2020, demonstrating that when households have increased income, emergency food access needs decrease.
As found in your definitions document, the Center for Disease Control carried out one of the largest studies on childhood abuse and neglect and their associated impact on life outcomes. This research showed how starting at conception, children who are exposed to certain adverse childhood experiences, or ACEs, are at an increased risk of negative life outcomes, including early death. Adverse childhood experiences can cause toxic stress, which when factored alongside living conditions, social networks, and systematic barriers, can be associated with poor education outcomes, decreased earning potential, poor mental health, and continued cycle of deprivation. By connecting clients with resources such as counseling that can help them address the trauma associated with adverse childhood experiences, clients will have an increased ability to build skills in emotional regulation, thinking, and planning that can improve their mental health and earning potential. The Alberta Family Wellness Initiative has a really cool course called the Brain Story Certificate that explains how our life experiences in childhood impact our brain development if you're interested in learning more. The Alberta Health Services Affordability of Healthy Eating in Alberta report presents a case study of Lauren, a 27-year-old with a 4-year-old daughter named Jane. Lauren is currently receiving social assistance because she is unable to find employment that would provide both suitable income to cover her expenses, as well as flexibility to ensure that Jane has childcare. Lauren and her daughter are facing food insecurity as they have a monthly deficit of $112.41 before food cost. Jane is not receiving all the nutrients that she needs for healthy development, and Lauren herself is skipping meals or eating low-quality foods as well. She is unable to provide Jane with the emotional availability that Jane needs. As a result, Jane is at risk of developing at a slower rate compared to her peers, which may have long-term implications on her confidence, cognitive function, and social relationships. 33% of single moms are food insecure. They experience food insecurity at 6 times the rate of two-parent households. Women are overrepresented in part-time work and only make 87 cents to every dollar made by a man, all while having higher rates of both high-level and diversified education. If Lauren is an Indigenous woman living on a reserve, she will likely experience higher and more extreme cases of food insecurity. 47% of Indigenous individuals living on reserves have experienced either moderate or severe food insecurity. All this information and statistics are important to give us some background into the unique barriers that people face when it comes to food insecurity. At the Calgary Food Bank, we play an important role in helping people access the resources that they need to combat their food insecurity.
Now that we know a bit more about the root causes of food insecurity and about how individual, social, and cultural factors can influence income security and therefore access to food, we can better understand the importance of providing our clients with referrals and connecting them with those external organisations who may be able to help. To make identifying the most appropriate agency referral as straightforward as possible, we have created several resources for you. The first resource you'll use is our referral questionnaire. This structured questionnaire contains specific questions that you will ask the client about their situation. Through collecting this information, the questionnaire will return names of agencies or programs that might be able to help the client. The second resource is your resource binder. This is only available online through SharePoint, and we'll show you how to access this on your first day of in-person training.
First, let's talk about the resource binder. The resource binder is broken into these 12 sections. The majority of these categories are what we would consider root causes of income insecurity. For example, someone experiencing homelessness might not have access to a shower and clean clothes to show up to an interview in, or someone going through a divorce might have to pay extra lawyer fees. Within each category are agencies and organizations that work with clients towards self-sufficiency. Resources are further broken down in each section into more specific categories. For example, within addiction, there's a section for addiction services for men, for women, for youth, and so on. This will hopefully help you be as specific as possible with finding resources. Also in your binder are a handful of these one-pagers. The organizations that we have listed in these one-page documents are ones that we have spoken to and have said that they are able to accept referrals and take on new clients, with the exception of Government of Alberta programs because they are generally always accepting applications. These one-pagers have more detailed information about the organization's services, such as how to access programs, any specifics around eligibility, and what the clients can expect when they first contact the organization and when working with them.
Let's take the organisation Skipping Stone, for example. Skipping Stone supports trans and gender diverse individuals. They will work with the person to help break down the barriers that they may be facing. If the person you're speaking to on the phone discloses that they are looking for supports related to their gender identity, you can refer them to Skipping Stone. It is important that you don't assume anything about the client's sex or gender. Skipping Stone offers peer support, which is when a volunteer provides informal support within a professional setting. The role of a peer support worker is often to empower the client to be their most authentic selves. This includes validation and normalization of their experiences, system navigation, and providing resources, among many other things. To access Skipping Stone, clients must fill out an intake form either on their website, through email, or by calling their intake line. Once an intake is completed and the client thinks that Skipping Stone is a good fit, they can start accessing services. Skipping Stone does great work to tackle the root causes of food insecurity. They help to instill confidence and curate a sense of community among the 2SLGBTQ+ community, along with reducing the unique barriers that these individuals may face. With connections to a support system and appropriate resources, we are better equipped to take on the world.
Next, we will go through each section of the resource binder and talk about some of the resources and agencies listed. The first section is addiction. You might have someone looking for resources for a loved one, or they might disclose an addiction to you. Some good go-to resources for addiction are Alpha House and Addiction Services with Alberta Health Services. Alpha House is more specific to clients experiencing homelessness compounded by drug and alcohol addiction. They have an interdisciplinary team of medical professionals, social workers, and so on who foster a safe environment where individuals can have their basic needs met while they are using substances. Some Alpha House programs include a shelter, a detox program, and a transition program for someone waiting for a treatment bed to open up. Addiction Services, through Alberta Health Services, is more of a starting point and a navigation tool. They can explore with clients their options within the healthcare system, which might include more intensive case management. Adult Addiction Services targets all areas of possible addiction, such as gambling, substance use, and so on.
Community support is a section in your binder that is broken into city quadrants. The agencies listed in this section are general system navigation resource hubs. These agencies work by getting to know each client's unique situation in as much depth as the client is willing to provide and offer referrals from there. They can spend more one-on-one time with a client than we typically will. They can be a good resource if the client doesn't really know what they're looking for, or if they need help filling out forms or applying for benefits. Resource centres don't have much in terms of eligibility criteria, and they will meet clients where they're at. In this slide, we have 5 examples. Patch is a program within the agency Hull Services, and Community Connections is a program within the agency Trellis. Both Trellis and Hull work with at-risk children, youth and families to build positive connections and develop competencies by addressing trauma, mental health and building resiliency. Since Trellis and Hull are large organisations with lots of other programmes, the referral process and intake process can be a bit more streamlined if coming through the respective programme, Patch or Community Connections. In the Northwest we have Rise Calgary. Rise Calgary used to be 2 different organisations, Bow West Community Services, which served Northwest Calgary, and Sunrise Community Services, which served primarily in the southeast. These organisations have merged and now Rise Calgary serves the entire city. We recommend giving Rise as a resource for clients living in the Northwest because there are not many organisations operating out of this area.
These 3 agencies here are general employment resources. When you go through the questionnaire with clients, it will generate more specific employment resources depending on what the client shares with us. Specifically, demographics who are underrepresented in the workforce or face really unique barriers such as Indigenous people, women, or older adults. However, MCG Careers and Prospect will help anybody looking for employment. They have lots of skill building, retraining, and job search supports, such as access to the hidden job market. Prospect also has supports available specifically for people with disabilities. This includes skill building, but also connects with employers to help them be more accessible so that employees with disabilities who are capable and qualified have the means to do their jobs to their fullest capability. Both of these agencies will draw on the client's skills and strengths to reduce barriers and direct them towards meaningful employment. Diversified Staffing is a temp agency, so temp agencies often help job seekers who have the training and are ready to find work to find short-term, often same-day employment. What often happens with these temp agencies is that once the job seeker applies, they will work one-on-one with a recruiter to determine the right fit. And then as job opportunities come up, the job seeker will be able to apply, or in some cases, the recruiter will call the job seeker in the morning and ask if they're able to come in. One thing to note with temp agencies is that payment varies. It could be same day, weekly, monthly, or even every couple of months, and payment isn't necessarily dependent on the temp agency, but rather on the employer.
Financial management resources are useful for clients who express that they have high debts, aren't accessing all the financial benefits available to them, or need help budgeting and living within their means. We already talked about Trellis's program, Community Connections. In terms of financial management, when we spoke to the program coordinator about what they do, she summed it up by saying, "We work with individuals who are motivated to attain economic self-sufficiency." Whether that is helping the person file their taxes, apply for their pension, referring them to another more specific root cause program or agency, Community Connections will make it happen. Momentum has a lot of financial management resources that are mostly preventative. They focus on education and building up assets before money becomes a problem. In terms of financial literacy, they have on-demand workshops on topics like budgeting, investing, as well as up to 5 one-to-one sessions for financial coaching if someone is looking for recommendations more specific to their situation. They also have a matched savings program, which allows people to access money if they're saving up for a specific goal, such as school. If the client contributes $50 a month, Momentum will match that and will also contribute $50 a month. This is a really simplified breakdown of the Match Savings Program, and there are some limitations and eligibility criteria that people must meet, but they're a great agency to help people get on their feet financially. Money Mentors is more of a reactive intervention financial management program that can help individuals and families explore their options for dealing with debt and bankruptcy.
Sometimes clients might not know specifically which root cause area they need help with. This group-specific section has more social supports and the names of organizations that work specifically with a demographic of people rather than with a topic.
The first resource we'll be talking about in housing is SOURCE. SOURCE is a multi-agency collaborative that connects people experiencing or at risk of homelessness to programs and services that can help address barriers to stable housing. On this slide is a list of some of the organisations within SOURCE: Alberta Health Services, the Distress Centre, Calgary Police Services and more. SOURCE is accessed on a walk-in basis and is located by the City Hall C train station downtown. Clients will go through a detailed intake and then be referred to the most appropriate agency within SOURCE. 211 is a good resource if clients are struggling to pay their utility bills or rent and are at risk of eviction. 211 can provide clients with the nearest Alberta Works office, and with Alberta Works they can explore one-time financial assistance, income support and more.
Calgary Legal Guidance and Student Legal Assistance are two legal services for low-income Calgarians. There isn't too much difference between the two of them. I would say it's more a matter of the client preference and availability and ability of the lawyers. Calgary Legal Guidance can cover a wider range of legal topics, whereas student legal assistance might be a bit more limited. But then again, I would leave that up to the client to decide with each of the organizations. Both are able to manage family, civil, and social legal situations. Calgary Legal Guidance and Student The binder has some more resources specific to certain areas of mental health, such as family violence, sexual violence, chronic illness, and children and youth, that we encourage you to look through if the client does happen to disclose that information to you. Otherwise, these three organizations are good starting points for mental health resources. The Canadian Mental Health Association is a Canada-wide organization with different branches throughout the country. The recovery colleges and peer-based programming are two of their main services. So recovery colleges is basically an online asynchronous class for mental health and coping strategies. This would be a good resource for clients who seem to have a lot on their plate, are feeling overwhelmed, and might not be taking the time to look after themselves. Peer-based programming is when people who have been impacted by mental health share their stories with others to normalize, validate, and help on their healing journey. The Distress Center is where you'll want to refer people if someone sounds quite distraught or overwhelmed. The Distress Center can provide emotional support, crisis intervention, and they also work closely with other services such as 211 and Alberta Health Services. Access Mental Health is similar to the Alberta Health Services addiction services that we spoke about earlier. They are a starting point for accessing and navigating services. So clients can phone Access Mental Health, and a clinical mental health professional will complete an assessment and provide referrals and recommendations from there. This is a good place to refer clients who are looking for some mental health supports and don't really know where to start.
This section, which we have termed miscellaneous or instrumental, is for clients who need more in the moment, specific one-off support. We would prefer that these resources are offered as minimally as possible and that instead we focus on the root cause agencies. But of course, life and emergencies happen, so these may come up as well during your phone calls. In terms of pet care, the Humane Society should be your go-to if clients are expressing that they are unable to provide for their pets. It may come up that we have been unsuccessful in providing them with cat litter, cat food and dog food, as these are donation-based items. The Humane Society offers an open shelter, education and awareness initiatives, and emergency pet supplies. The Humane Society also goes beyond dogs or cats, so if a client references any pet, it may be best to direct them towards the Humane Society. The Spay and Neuter programme with the City of Calgary can be accessed via the Fair Entry programme. The Fair Entry programme provides several city services for low-income Calgarians at a reduced cost. This includes a subsidised transit pass, entry into city recreation centres, and housekeeping services for seniors as well. People do have to apply for their Fair Entry programme and provide information around their finances, so it's not an instant thing to access. If clients are in immediate need of spay and neuter services, the Humane Society should be able to give them some more direction.
CUPS Calgary offers a range of health services for low-income Calgarians, ranging from general family doctor services such as checkups and referrals, to specialized treatment services in areas like cardiology, chronic pain, diabetes, and more. However, do note that dental, veterinarian, and optometry services are not currently available. If the client has complex health problems, which may extend beyond their physical health and into their social, mental, and emotional well-being, or they don't have a family doctor, CUPS is a great organization. The Alberta Adult Health Benefit is a great resource to offer to clients with high ongoing medical expenses, such as diabetes, or if they are pregnant to help with the cost of prenatal supplements and vitamins. Best Beginnings is another good referral for holistic care for people who are pregnant. So that is a summary of the resource binder. The one-page documents are of organizations that we have spoken to, but there are tons more resources in the binder as well. But next, we'll talk about the resource questionnaire. This is mostly what you'll be using to help identify resources and referrals for clients. Remember that the clients that we are speaking to are here because they want to be. Referrals are not mandatory at this time. It might be a bit awkward the first few times you offer a referral, but it will get easier, and it's okay to let the person on the other end of the phone know that you are using a questionnaire that we designed and it's a bit of a newer process. There are some introductory paragraphs at the start of the questionnaire that you must read to the client each time. These outline the scope of your role, what the client can expect, and limits to confidentiality. We'll also go through some practice scenarios during your first in-person training shifts.
This is the general flow that the questionnaire goes through. To note, this survey is completely optional for clients. Before you get into the criteria and resource questions, you'll be able to fill out if the client chooses to complete the survey or not. As we begin to have repeat clients who have already been given a resource, they'll also have the option to give us feedback on their experience or lack of experience with agencies. If the client chooses to complete the survey, you'll ask the client about their employment situation. This includes, is the client working and are they able to work? As we discussed, the root cause of food insecurity is income insecurity. The most common way, if it is possible for the client, is to combat income insecurity by increasing income through employment.
Here are some examples of the employment questions that we ask in the questionnaire. If the client is unable to work, we will ask if they identify as any of the following: senior, disabled, a newcomer, or parent or caregiver. These 4 categories often have additional barriers that impact one's ability to work. If the client or someone in the household is able to work, the questionnaire will then ask some questions about their identity. These include senior, Indigenous, immigrant, youth, woman, disability, parent, or caregiver. These categories all have employment resources that are specific to that population generated within the questionnaire. But please note that this questionnaire and these resources do not take into consideration intersectionality. While a client might be an Indigenous woman, this survey will show you resources for Indigenous people and for women. This is because we try to keep the questionnaire as straightforward as possible, and there are very few resources explicitly designed for intersecting identities. It is important to highlight that the client's answers throughout this questionnaire are not stored on their WebDAD profile. The only information that we link to them is the organizations that they're referred to, and this information will have no impact on future hampers.
The survey will then move on to the Other Needs section to determine where the client could also use additional support. The questionnaire will ask the client if there are any additional areas in their life that they could use resources for, such as identifying benefits, housing, high utilities, child expenses, high debt, mental or physical health, employment or social supports. If the client is unable to work, they may like resources for one of these needs. Depending on what is entered for the client's identity, specific resources related to each identity marker will appear.
If the client says that they have insufficient funds for their rent or utilities, please keep in mind that there are few resources, and these resources often have long wait lists and strict criteria. For example, some people have been on the wait list for Calgary housing for 3 years with minimal updates, so just something to keep in mind when exploring housing resources in particular.
Here are some important things to consider when offering referrals. Try not to give clients more than 3 resources. We can explore more if they phone again in the future, or you can direct the client to phone 211. It's common for people to become overwhelmed if they're given too much information at one time, and we want to make sure that the client has capacity at the end of the call to research and contact the agencies. 211 might have a more expansive list of resources that the client can try as well. Don't feel like you need to solve the client's entire life. People are capable, and if we give them a starting point, they can take it from there. Be patient. Clients with barriers, such as language or hearing, might be the ones who need the most support. Again, be mindful of intersectionality, because this survey is not designed to be so. As you go through the survey, you will become more comfortable picking out different resources based on the information the client provides you with.
This concludes the training presentation.